Welcome back. Next, we will hear from Chinmayee, who works as a genetic counselor at Cincinnati Children's Hospital. She is part of the neuromuscular clinical team at the hospital and serves families with neuromuscular conditions. She is also part of the diagnostic genetics lab at the hospital, where she facilitates appropriate genetic testing and reporting results. She is actively involved in research efforts and training grad students and fellows. Chinmayee, I'll let you go ahead and present. Thank you for being here today.
Thank you for the introduction.
Uh-huh.
I've been looking forward to this. Good morning to everyone. Hope you're all having a good morning. So I'll go ahead. So I have a pretty brief presentation here. I wanted to have it short and broad so that it would be a good discussion for everyone. And I also wanted to leave enough time afterwards for any questions you all might have. So I will take up about 25 to 30 minutes and hoping that we'll have some questions afterwards. The things that I'm planning to cover as we go is just talk about what is a gene, how do they help us with the different functions that we need to do, why is genetic testing needed for neuromuscular conditions, how is the genetic testing process done, what are some limitations of genetic testing, and finally just a little bit about the role of a genetic counselor in neuromuscular clinic. So starting with what is a gene, we are all made up of many cells, very small cells, trillions of them, many cells. That's what we're made up of, our body. So our skin, our muscles, our organs, all the different tissues we have, they're all made up of these tiny cells. And at the center of which there is something called nucleus. It's within or inside this nucleus that we all have our DNA. We get half of our DNA from our mother and half of it from our father for most part. The DNA is like a long thread, and there are a few different threads we have. Each thread is wound tightly into a spool called chromosome. So inside our cells, almost all of our cells, we have this nucleus which has these spools of threads called chromosomes, which is made of DNA. And the DNA thread has small sections that make up different genes. So as humans, as individuals, we have about 15 to 20,000 genes that help us do all the different functions in our body. Now that we've seen just what a gene is, let's take a look at how does it help us do our functions. If we think of oh, it skipped one. Let's go back. Can you help me go back one slide?
Yes, let me see.
Yes, thank you. Yeah, I'm wondering if I lost the control. I'll let you know after this one.
Okay, it still says you've got it. So yeah, we'll see.
Sounds good. If you think of our DNA or our genes as the blueprint inside our body, then there is a transient stage where copies of this blueprint is made and all the raw materials that's needed for the end product, which is usually proteins, that's taken to the location where they're all put together. And it's in this, the end product that's made from our genes, that's the blueprint, is proteins. We have hundreds and thousands of genes which help us to make hundreds and thousands of different proteins. And it's these proteins that either act by themselves or interact with each other that help us do all the different functions we do. from as simple as us sitting now, being able to look, being able to understand, talk, eating, digesting it, being able to walk, run, literally every function that we're able to do, from learning to growing to our daily functions, they all are part of what um, they all come about because these genes help make these proteins that help our body with all these different functions. So you can imagine that if then there is an issue with one of these genes that help us with these different functions, it might cause a problem doing that function. And sometimes that can affect our health and cause some symptoms. Going to the next slide. I might need your help with that. Thank you. Coming to the next slide, let's talk a little, now that we have looked at what are genes and what do they actually do, we can talk about genes in terms of the neuromuscular conditions. So there are many genes that help the muscles with growing as they should from birth to adulthood and maintaining them later on in life. There are many genes that help the muscles to be able to contract and relax, do their job so that we can use them. There are many genes that help muscles communicate with the brain, the spinal cord, basically get the information from the nerve cells, which is what tells them what needs to be done. So there are many genes that are involved in maintaining a healthy muscle, for it to be able to do its function, for it to be able to communicate with the brain to do its job. And if there is any change in one of these genes, it then causes an impact in the function, and then that causes the muscles not being able to do their job as the proteins that help them, they're not able to help them anymore, which affects the muscles to do their job. The neuromuscular conditions are a pretty broad range of conditions. It's a big category with around 200 conditions that fall under it. Some are pretty common. We have, you may have heard of them. You may be familiar. Duchenne muscular dystrophy, spinal muscular atrophy. Some of them are more common in occurrence, as well as some are more in the news too. Others are many limb girdle muscular dystrophies, myopathies, many of them, some neuropathies. They are much less common in occurrence as well as in the discussions when we talk about them. But neuromuscular conditions in general are as common as 1 in 1,000 individuals worldwide. These can show up early in childhood, or they can also show up later in adulthood, some of them. They can be very severe, some can be mild. So it's a pretty broad range of conditions, and different genes, about 500 genes that we know of as of now, are associated with causing one of these different neuromuscular conditions. Having talked about what's a gene, how does it help us do our functions, and how do genes correlate with neuromuscular conditions, let's talk about why is it important to know what gene might be causing symptoms when we are trying to diagnose a neuromuscular condition. A lot of these conditions have very overlapping clinical features. So as clinicians, when we look at it, it's not always easy. Sometimes we are able to suspect one diagnosis over the other, just based on some being more common, based on maybe sometimes some unique feature that we catch. But most times the overlapping symptoms can really be very difficult and challenging to tease apart the different genes or the different diagnosis that is causing the symptoms. So genetic testing, when it comes to that, testing the genetically testing to check and see what gene is exactly causing the symptoms can be very helpful for many reasons. One, knowing exactly what gene is causing it and what the condition is will help us assess how is the condition going to progress. Is it going to be as we are seeing it now? Will it become more severe as the person grows? Will it become milder as one grows? So we'll be able to assess how it's going to be progressing and how to address it. We can also assess the comorbidities, meaning what other symptoms can show up that we're not seeing now. As an example, heart issues are very common with many of the muscular conditions, and but for some conditions, heart issue is not part of it. So knowing what condition it is, we would know that this is someone we need to be screening for cardiac risks because there is that associated risk with this gene, with this condition. For others, knowing the gene and the condition, we might know that we don't need to be screening them for the cardiac risks because they don't have one. They don't have one with this gene, and it can save us the cost, save us the trouble of putting them through the screening efforts. The next is knowing what gene and condition is the causative factor will help us know how to specifically manage and treat the patient. There are some drugs, some medications that are specific to different conditions. So, and knowing what else to suspect will also help us know how to manage. Many treatment options, including some gene therapies, gene therapies are available for very few conditions. There are trials for some, and um, the gene therapies are very specific to the gene. And sometimes the trials and therapies are very specific to even the change within the gene. Depending on the change within the gene, the trial or the treatment can be different. So in those situations, knowing the exact change, the exact gene can be very useful, even to be eligible for those trials and treatments. Um, the next thing it helps with is not just for the individual, but for their family. Knowing the gene can help us know what kind of inheritance does it, is it associated with in the family in generally. And knowing that will help us know who else in the family is at risk for similar. Are the siblings at risk? Are they at an equal risk? Are the parents at risk? Will the children of the individual who has symptoms, will they be at risk? Um, or will the risk be dependent on the partner's risk as well? So we will have information then to go with to assess the risk for other individuals. It will open options to be able to test them, to figure that out for them. So that can definitely be a benefit. Um, when we are able to do genetic testing and when that does give us an answer, it can also be cost effective. Yes, genetic testing is not always cheap, and doing multiple tests the cost also adds up. But if we are able to do it and get the answer, it does save a lot of other screening and management and other diagnostic procedures that we can, avoid, or that might not be needed anymore because we know what it is and we don't have to keep looking through different methods for it. Um, Also, when we are able to have an answer, it certainly helps the family with knowing the causative factor, knowing what to expect, knowing what to do, and it certainly helps them psychologically deal with the situation much better. Genetic testing doesn't always lead to an answer, and so it doesn't always um, provide that opportunity. But even when the results are negative, there is the small reassurance that we have tested for some common conditions that is better ruled. It's ruled out now. We know that that's not what's causing it, and that's we know what steps not to take or what condition it's not, and that is still helpful sometimes. Okay, moving on to the next slide. um, you all may have had some experience with genetic testing, and or may not have had. Just to touch briefly on what does the genetic testing process look like. Typically, when we do genetic testing, there is some sample that we obtain. It can be blood sample, but we can also do saliva sample, which is quite common now. We can also do biopsies or other tissues. So blood is common, but we can use other tissues and samples as well. And as we saw, every sample or tissue, including blood, has cells in them. And these cells, inside these cells, there is the DNA, our DNA. So what we do, the first step of genetic testing is, from these cells, we extract this DNA out, and that is all that's used for the testing. It has to be done within a few days of getting the sample. So, there is some time restriction there. If you look at this tube here, this is what DNA looks like once it's just a white translucent material. That's what DNA looks like once it's extracted. Once we have the DNA, then we do the actual testing process. The test that's shown here is called sequencing, and that's the most common method we use for testing. There are many other methods too. So part of what the clinical team does is to see, what do we need to be testing? Do we need to be testing one gene? Do we need to be testing a group of genes, 50 or 100 of them, or even larger group of genes, hundreds of them? There is also the option of testing all of the genes together. So the clinical team just weighs the different, each of these methods too, depending on how many genes we test, or how we go about the testing. Are we going to be sequencing, which is, if you think of the genes as a sentence, and multiple genes as many sentences, so paragraphs or chapters in a book, we can be reading one sentence or multiple chapters or the entire book. And sequencing will basically be doing a spell check. That's what the method does. We can be doing that, or we can do a test called deletion duplication, where it doesn't do a spell check, but it looks at chunks, the big portions, and sees if there is any sentence or any paragraph missing. So there are many different ways to go about testing, and that's what the clinical team tries to assess. What's the best? What do we suspect? What group of genes, or do we want to go broader? Do we want to keep it more focused? And what kind of technology or method do we want to use to look into those genes to find the causative factor? And that is why sometimes when we have negative result through one test, we think of another test, because given the drawbacks of one test, we can try to optimize for things that one test might miss, that the other would find. So it takes a little bit of the judgment of what the methods tell us and how to find things in different genes when we go about these testing. And that's why we have many different tests to choose from when we do a genetic test. And also why sometimes we do test one after the other when we have negative result, and can't just do all of them at the same time. Every method has its own things that it's good at, that it does, but also things that it's not able to do. There is no one test that can look at everything at the same time. Although those technologies are also coming up, so there is a lot of growth and lot of update in the field, and we are moving towards technology getting better and better, but there is still quite a bit of limitation. So once the testing is done, the sample DNA that's processed, what we end up getting is raw data, which is in the form of some graphs, some numbers, some diagrams, and the professionals in the lab then sit together. There are many databases, many resources, many softwares that help them try to understand what this raw data means. Unlike, let's say, a CK test, a blood test, where you're trying to see if the level of the enzyme is more or less than a certain point to try to assess if there is any damage to the muscle. That's what we are trying to do with the CK test. Unlike that, where we're just looking at a range and saying, is it more or less? DNA testing is a little bit more complex in that we are reading the DNA and we are looking for spelling changes, we are looking for missing chunks, and we are trying to make sense of what that might mean for the protein and for the job it does and for the kind of symptoms it can lead to. So sometimes when we do understand the DNA language well enough to be able to make sense of it, but we don't understand it excellently. We don't have a complete grasp of it to always know what it means. Some changes are common. It's just difference between the different individuals, all of us. So some changes in the DNA is just a variation in the population, whereas others can impact the protein, which will impact health. So when it comes to assessing or interpreting what it means, what we are trying to do is we are trying to see, is this a change that's just it's just a difference in the population, or is this a change that is going to be actually causing symptoms? So it takes quite a bit of effort to do that. And once that step is complete, then they put all of the information into the report and get it to the clinical team and the family. And this is why we can have a positive result where we have some answers to what the diagnosis might be. We can have a negative result where maybe they didn't find anything in those genes. Maybe it's a different gene, or maybe we just couldn't find anything because of some limitation in the technology. But we can also have inconclusive or uncertain results because they found a change, but they are just not able to say whether the change is going to be causing symptoms or if the change is just a variation in the population. They're not able to make the determination. So the genetic testing process is quite complex, and it's not black and white. There's a lot of gray there in trying to understand the result. Now that we have seen, what genetic testing looks like and what are some benefits of doing it, it's important to also know what is the chance of finding an answer when we do genetic testing. Typically for neuromuscular conditions, and this is true for almost any other kind of, any other set of conditions, any other disease group, the chance of finding an answer through all the different tests that's out there is about 20 to 30%. About 60 to 70% of the time, we don't, even if we have done all the genetic testing that is possibly out there, we don't find an answer. Based on all the reports that's out there, the average is 20 to 30%, but the range is as low as 10 to 12% to as high as 45 to 50%. But the majority of the time, basically, we don't find an answer. We find it only in some cases. Why is it so? Mainly because even if our technology is at the best it has been, there is still quite a bit of limitation. It's certainly, there has been a lot of improvement in the technology in the last 5 to 10 years that I have been able to witness, but I can say for sure that there is a lot of updates coming to these technologies as well. So it's going to get better. Also, I think the other more significant limiting factor is that as much as we know in this field and as much as we have learned and understood, there is still a lot that we are still learning and we still don't know and understand. We are growing as we see and learn. We are also imbibing those and putting that into our knowledge bank, sharing with other professionals and trying to grow with the information that's out there. But there is still a lot that needs to be learned. So that's why we don't have answers most times. It does help to go back, especially if we have had negative or uncertain results, to go back after a few years and either redo the testing or do a different test because there is more options available that wasn't there before, or repeat the test because the technology is better now and can pick up things that it could not have picked up before, or sometimes just repeat analysis because the test was fine, but the knowledge, the analysis of the data that we already had was not up to what we can do now or what we can do later. So we can always retest or reanalyze every few years to see if we can find more that was missed before. And that's how we approach clinically now for families where we don't have an answer. We try to see if we can find the answer every 2 or 3 years. There are certainly a lot of benefits to doing the genetic testing, and we talked a lot about that. There are some things that we should also keep in mind when it comes to genetic testing. One of them is there is an act called GINA. It stands for Genetic Information Non-Discrimination Act. This was passed a couple of decades back, and it basically is a protection for those who have a genetic diagnosis, either through genetic testing or just clinically, the diagnosis has been established. This protects them from employer discrimination, which even the privacy law should help with. But there is some caveat. If the company is really small, I think about 50 people or less, then it probably doesn't protect them. It also extends protection from, individuals will, even with genetic diagnosis, they will get a health insurance. The insurance companies can't deny it because of the protection this act provides, but it doesn't help with increased premiums that they can charge. However, on the other hand, it doesn't help with life insurance or disability insurance, which can be denied based on a genetic diagnosis. It depends on company to company and how they handle these things. But this is the protection that's available, that is out there. But we've also seen some gaps in what this offers. Also, when we do genetic testing for one individual, it reveals the risk for that condition for the other relatives in the family, parents, siblings, their own children, extended relatives, and it can be difficult. It can be one unexpected. The family is already dealing with a lot, and getting additional information like that can be difficult. It can also be tricky to know or challenging to know what's the responsibility. Do they need to be, what should they be relating to their relatives? Do they need to let them know of the risk, and so on? So it's an added challenge in the situation. Situations where a family knows their risk for having children with a certain condition and where they pursue prenatal testing. In cases where it's a positive result, it can certainly leave the families with very difficult choices, none of which can be easy. It can be extremely difficult for families in that situation. Also, when families have tried through different genetic tests, spent a lot of their effort, their hope in trying to find an answer, and when they still don't have an answer after that, through inconclusive or negative results, it can be very frustrating, and almost to the point of losing hope. Having answers can certainly be very, very helpful to to move forward with. So it can be very difficult for the families to not have those answers. And I'm not sure how many of you have had the chance to meet with a genetic counselor as part of your the neuromuscular clinic experience. But these are the different kind of things a genetic counselor typically brings to the neuromuscular clinic or helps the other specialists with. They help decide what kind of genes should be looked at, or what kind of technology or method should be looked at when considering genetic test, or what test should be done and in what sequence. They help with the figuring out the cost of it, working with the insurance to help the families lower the cost, and to see as much as possible if it can be covered. Once the results are back, they help the families understand what the result means for the individual, also for their family, as they grow from childhood to adulthood, as they grow. Also talk about bring back the discussion and talk again about what's their risk now, when they're considering children of their own to have to pass it on, and what are their options at that time, and basically educate the families about all the different options out there so they can make informed decision that sits with their perspective, their how they want to plan their life. I've included a link here. This, in case you've not had the chance, or in case you know of someone who's looking for a genetic counselor, this is the link that they can use to go find a genetic counselor in their geographic area. And they can always get a referral from their physician, their doctor, for the same. I try to keep the presentation broad and simple, given it can be taken into depth in so many different directions. I wanted to keep it such that it would serve most people. So I'm happy to take any questions that any of you might have for me at this point.
All right. We do have a couple questions that came in. I know that you had mentioned about in utero testing. Is that for any muscular dystrophy, or is that just for a certain muscular dystrophy that you could do in utero testing for?
So we can do in utero testing for any of the conditions. Typically, when we do it is when we already know, when there is an individual in the family who has a muscular dystrophy or any other neuromuscular condition, and we know genetically what is causing them that. Without knowing that particular genetic change that's causing the symptoms in that individual in the family, we wouldn't know what to test for in the baby or in the fetus in utero. We can't go looking for everything broadly there, because it can have its own drawbacks. We might find things that we don't know what it means, and that puts everyone, including the family, the clinicians, at a very difficult situation of what do we do when we find something that we don't know what it means, especially for a child that's yet to be born.
Okay.
So we typically do the testing when we have an individual in the family who has symptoms. We know what's causing it. Then we can test for the fetus or the baby specifically for that change, and find if the child has the same condition or not.
Okay. Okay. If you have a complete DNA profile done through genetic testing, can researchers or doctors use that profile in the future as a genetic variation was identified, but at the time of the test, the significance was unknown? Or would genetic testing have to be completely redone to be of use?
That's an excellent question. And I think the answer is both yes and no. It just depends on what kind of genomic profile was done. There are some tests called exome sequencing, which looks at all of the genes that we have. So that profile it's a pretty comprehensive test. It's looking at every gene we have, which I wouldn't say is 100%, which I would say is about 95, 98, 99%, depending on the lab. And if that result is coming back to be uncertain or negative now, there is definitely value in going back to that result in 2 or 3 or 4 years and saying, can we just reanalyze the test? We don't have to redo the test, but can we just look at the data again and see if we missed something then, but can find it now, just depending on the increased knowledge we have in the field. But there is also another test called genome sequencing. The previous
Okay.
one was exome, the other is genome, which is not just looking at all of the genes, but it's also looking at every region between the genes too. So if we think of all of, if DNA is a thread, and if we think of small sections of it being genes, there is a lot more of the thread in between the genes that connects them than the thread that actually makes up the gene. So the genome looks at even the in-between region and is able to pick up a few other things that the exome might miss. So when it comes to seeing, should we redo the test or should we just reanalyze the information, it just depends on when was it done, what new things do we have now, and what's the best way probably at this given time to be able to find something new. So it's just weighing out the different pros and cons of different approaches. And it might also be that we do one thing first, and then if that's negative, we try to do the next thing afterwards.
And I would just ask if that question, if the person that submitted that question would want to elaborate a little bit more, that's perfectly fine if you want to tell us what kind of test you did have done. Also, what about, an inconclusive test? Is it always going to be inconclusive, or, do you need to have it retested again, like you just mentioned?
The hope is that it's not always going to be inconclusive. It's inconclusive now because we are not able to understand what it means at this time. So if we think of understanding DNA and DNA test like we learn a language, when we have started learning and understanding a language to some extent, we know many words, but then there are many words that we don't understand. So there are some DNA changes we come across that is a new word for us. And what we are at that time, we are going to say, we don't know what this means. Because overall in the field, that's all the understanding we have. We can't even ask each other to understand what that word means. But if we give it 3 or 4 more years, our hope is we'll understand more words by that time. So the hope is that in a few more years, we can go back to that change and say, we have a better understanding of this word now, and it means, it doesn't cause any symptoms, or no, we know that this actually causes symptoms, and this is the answer. But in my experience, sometimes it just takes 6 months, a year, or 2 years at the most for us to understand a new change, a new word, and say, hey, we've seen this a few times now, and we've done some additional testing that has helped us know that this is what this means. This change means now. This is not uncertain anymore. We know this is either benign or this is pathogenic, meaning it causes symptoms. Benign meaning it doesn't cause symptoms. But other times, I've also seen a variant remaining uncertain for about 10 years, and it's still uncertain now. And that's just because that particular word, we have still not come across it. We still don't have tests that we can do to understand it better. So it just depends on the specific change, the kind of gene it is in, and what we learn is we just have to see what it is. So it's very dependent on how things go for a particular change or a new word, so to speak.
Okay. I like that analogy. They typed in and said that they had both testings done. After the genome was inconclusive, the neurologist ordered the exome testing. So, what about
and that's I'm really sorry to hear that. This is what I was trying to get to when I was touching on, even if we do exome and genome, even then the chance of finding something is only about 30% generally. So 70% of the chance is that we may still not have an answer at this point. The hope is in the future, in the next 4 or 5 years, that might change. Maybe it'll not be 30 anymore. Maybe it'll increase to 50 or 60%. It's going to take a while for us to be able to find everything, understand everything. But hopefully, we can find things that we are missing now. It's only about 30% that we are able to find answers for.
And I know genetic testing is expensive, and there are insurances that do cover it, or no?
They do cover it. It's certainly very dependent on different insurance,
Sure.
but the Medicare, Medicaid certainly set, an example, and a lot of the commercial insurance then follow them or sort of have to. Um, and the Medicare, Medicaid does do a pretty reasonable job of coverage for genetic testing, and even the commercial insurance, many a times, they'll just say, yes, this is fine, you can go ahead, do the testing. Many a times we reach out to them beforehand to check to make sure they are going to cover it before we proceed and we receive acceptance. Sometimes we receive a denial irrespective of how much effort we put into the argument, how much we try to be on the phone with them or write letters explaining why, show them literature, everything we do, and we still get a denial. So it just depends on the type of insurance. It's very dependent. I wouldn't be able to say, this does a better job than, that insurance. I think they all fall in the same range. But generally there is coverage. I wouldn't say it's not covered. It is covered pretty reasonably. I just want to touch on this another thing here. There are some programs too, especially for some common conditions like the Duchenne muscular dystrophy, spinal muscular atrophy, but even some broader neuromuscular, muscular dystrophy, and myopathy conditions where labs offer free of cost testing, or limb girdle muscular dystrophy, just so that that option is available for the families. The way is there are some either research groups or some pharmaceutical companies that are trying to work on solutions, drugs, medication, and trying to understand the genetics of it a little bit better so they can do a better job with what they are working on. And so they pay the money to the lab, and the lab offers free of cost testing to the families, and in return they provide information to the research group or the company, but they take off any identifying information. So they just provide them scientific data saying, if these were the symptoms, this is what we found. And that's all. They send it back to them. So it's not really going to affect the individuals. It's definitely a good option, for the families. So that's something we always keep in mind as an option for the families when we can, to be able to offer the testing for free.
Sure, that's definitely the preferred method. So just to follow up on that insurance question, if you do get an inconclusive test and you want to get one done the following year, or maybe every 2 years until you can actually find out what's going on, is that something that they would allow, or would they deny that request to have it repeated?
They do. Again, it just depends on the argument we are able to put forth. Not all of the if we have an uncertain variant, not all the time it costs us money to do the test. Sometimes if we have an uncertain variant, but we want the lab to either repeat the test or repeat the analysis, then we have to pay them. But if you're just going to, in a few years, ask the lab saying, hey, we found this change or word, and at that time you said you didn't know what it meant. Do you know what it means now? And we can just ask that question, and the lab will just give us the answer. They'll say, we still don't know what this word means. Or they might say, yes, since then we have seen it in, 5 or 6 other families, and now we know that this actually causes symptoms. And that's free of cost. So that doesn't cost us money. And we do that quite regularly. They'll provide us with an updated report when that happens. And the clinical team is the one that keeps track of that and checks with the lab every few years. Many a times we do that in the background, with so much discussion we have with the families. Sometimes we do make it a point to let them know, hey, we checked it. It's been a few years we checked, and it's still the same. But it definitely, we try to do that in the background on a regular basis. Other times when it's a step where it costs money, it depends on the argument that we can put forth to the insurance. If we are saying there have been some new symptoms that we didn't, that the individual didn't have when we did the testing previously, So there is more value in doing this reanalysis. Or here is the data that shows if we do it every 2 or 3 years, this is the chance of finding something new. It's 10 to 15% of the time that we can get an answer. So we want to try it again. So sometimes that helps. We will cover it. The reanalysis is not always as expensive as the initial test too. So that also helps. But other times it's denied, and we just have to find other ways or just wait.
Okay, that's good to know. It's nice to know that the clinicians are looking to on the back end, and so it's nice that they're advocating for the patients that way as well. I do not see any more questions that have come through. I think that would probably be it. So thank you, Chinmayee, for your help and for helping us understand this kind of convoluted topic. So thank
Yeah,
you very much.
yeah, I'm very thank you for inviting me. I was very happy to come speak to this group. Genetic testing is certainly something that looks or seems or sounds very mysterious, but it's not. When we just tease it apart a little bit more. I'm happy to answer any questions that come up later to you.
Okay,
If
perfect.
you to direct it to me.
That's perfect. Thank you. Thank you
Yeah,
very much. Have a great rest of your Saturday.
thank you. You all as well.
And we're going to take a quick break and get our next presenter set up. So we will be back at the top of the hour. So stay tuned. Thank you.